Hi, and welcome to Centra Scripts. I am Cami Smith, and I'm here today with Lentz Dorcely, who is the corporate director of Centra Infection Prevention. And today we're going to be talking about what some of you have probably been hearing on the news, if you watch the news. If not, maybe in your social circles and within our community, and it's monkeypox. And depending on where you're getting your information, there is a wide range of numbers are increasing or numbers are decreasing, and it's confusing. And we want to know what we need to know to protect ourselves, to protect our community, how we can really prepare. And so we're going to have that conversation today. So Lentz, thank you so much for joining us. And before we jump into all of that, because we do want to pay that the seriousness that it deserves, I want to know a little bit more about you. So how did you come to be at Centra? What's your background?
So I've been at Centra now for going on about my third month or so.
Okay.
My background's in public health. I have my master's in public health. I'm working on my doctorate right now, also in public health. Specialize in infection control. I've been doing infection control for about 8 years or so. Came to Centra on a consulting basis, and now I've transitioned over to become the permanent director for the infection prevention program.
Okay. So are you also new to Lynchburg?
I am new to Lynchburg.
Welcome.
This is my first time in the state of Virginia.
Oh, wow. So you're new to the area. What has been your new favorite thing about Lynchburg?
My newest favorite thing about Lynchburg, I'd have to say it's got to be the views. It's got to be the views. We don't have mountains down in Florida. Everything's flat. Just driving, the views, the trees, the greenery.
Yes.
That's probably been, I'd say, my favorite thing so far.
It's so beautiful. I have definitely fallen in love with Lynchburg as well. It's about just as hot here as it is in Florida, maybe a little hotter in Florida. But it's nice to see that you're settling in, and welcome to the community. That's really exciting. So, so your background is in infection prevention, and would you say that coming out of a COVID season and now, hearing about monkeypox, and are there any similarities just at first glance before we really dive into what monkeypox is?
Coming out of COVID, there's definitely the heightened awareness around pandemics, any new diseases, infection prevention as a whole. But compared to COVID, there's some similarities, but I would not say monkeypox is like COVID so far.
I bet a lot of people just breathe like a huge sigh of relief because I think that is a fear that we have, and not just in our community, really around the country, around the world. We're hearing something else is here. And I know I'm not ready for that. And so then let's just talk about it. So what is monkeypox?
So monkeypox, it's a virus very similar to the smallpox virus. Causes, like you see in the characteristic rash. It also comes with flu-like symptoms such as swollen lymph nodes, fevers, muscle aches, body aches. Monkeypox is not a new disease to us, kind of like COVID-19 was. It's been endemic in parts of Africa for several years now. But what's new about it now is the pattern of transmission. So now we're seeing it spread a lot more with close and social interactions and intimate interactions, which we have not seen before, where it's been mostly endemic, in certain parts of Africa. So right now, the illness is not as, from what we've seen, not as severe as COVID-19 was, where we've had hospitalizations were up as well as soon as COVID came. So far, that has not been the case with monkeypox.
Okay. Very good to hear. So once you have symptoms, it's just the rash. What other symptoms are there associated with monkeypox?
So in addition to the rash, we'll also see patients that report fever, might also have swollen lymph nodes, body aches, fevers, much of the same flu-like symptoms that we see with the seasonal flu. The symptoms themselves pretty much can be treated at home. they really don't last more than 4 weeks. Usually after between 2 to 4 weeks, most people fully recover from monkeypox. And symptom-wise as well, I'd say so far, we have not seen the hospitalizations or the deaths with monkeypox.
Yeah, that's encouraging
that we saw even in the early onset with COVID so far. So encouraging from that aspect.
Yes,
sure.
Absolutely. And also good for people to know, because I think when you hear flu-like symptoms as a symptom, just about everybody, especially this time of year with people going back to school, college students, and elementary level, high school level, everyone is getting that first 3 weeks of school, like, contagious thing. And it's expected. And so when you have those symptoms and there's something else out there, it can be a little scary. So there is an identifying rash that can help you decide whether or not you need to take the next step in getting any kind of treatment, or at least reaching out to your doctor.
Correct.
Would you say that's accurate?
I would say that's accurate. The other thing I would add, with monkeypox, what we've also seen is that the flu-like symptoms don't necessarily come in simultaneously with the rash. We've seen it where the flu-like symptoms might appear prior to the rash. We've also seen them where the rash comes first and then the flu-like symptoms follow shortly after. And in some cases, they come both at the same time. So exactly like you pointed out, we're approaching flu season, so it's kind of say, hey, is this muscle ache that I have, is it monkeypox, or is this another, bout of the flu? And really, the same, it kind of goes back to the same practice that we've been preaching with infection prevention. If you're sick, stay home, take care of yourself, until you can figure out what it is. With monkeypox, you're going to get the rash. So monitoring yourself, even sexual partners or anybody you're intimate with as well, find out, have they been feeling sick? Do they see a new blister or a new rash that they should let you know about? So
when COVID was being introduced to our community, I think that the thing that was so unnerving is if you didn't have any symptoms, you could still potentially be contagious. And so, I remember leaving the grocery store and putting on hand sanitizer, and I had wipes in the car, and I'm wiping my steering wheel and just not. And of course that was, the first early weeks where we were all we didn't know. Would you say that monkeypox, you can have the virus and not really have any of those symptoms yet and still be contagious? And let's, for our community's sake, could they be at Target? Shopping, should they be concerned? Should they be taking precautions? As you're pumping gas and you grab that handle and you just, we don't think about it anymore. But should we be cautious in those environments?
Definitely should be cautious. I'd say two parts to that question. So first, the asymptomatic spread. We saw with COVID, it could be asymptomatic and you're infectious. With monkeypox, so far that has not been the case. Usually it's been spread through direct, close person-to-person contact, skin-to-skin contact, intimate sexual contact for a prolonged period with someone who is infectious, has the blisters. That being said, there was a new study that came out that did show there was about 200 people or so where they did see asymptomatic people, they were infected with the monkeypox virus and were not showing symptoms, and they were still considered contagious. But a very, very small percentage that doesn't represent the full picture of monkeypox. And then in terms of, being at the grocery store, pumping gas, should you be concerned? One of the ways monkeypox is transmitted is through secondary contact with, items, even bedding or other surfaces, fabrics that someone with monkeypox has touched, or their lesions or the rash, that fluid inside of it might have, gotten on that surface. And then I come after, you touch that surface, you are at risk of acquiring monkeypox through that route. It's less likely and it's less riskier than, that direct face-to-face or direct skin-to-skin intimate contact, but it is, a mode of transmission for monkeypox, which is why, if you were with COVID, you were bringing your disinfectant wipes with you all the time. I'd say continue. The other thing we just say, if someone you know might have had monkeypox, or someone was exposed to monkeypox, you probably want to avoid sharing bedding. You want to avoid, sharing clothing with that person, eating utensils with that person. So there's those, basic infection prevention practices that a lot of us, got really good at during COVID. I say with monkeypox is definitely worth continuing. You know?
Well, and I would even say in general, like it's just, it's good to be safe. The whole washing your hands. It was interesting how we have always said, wash your hands, count to 20 seconds. Like I remember that in elementary school. And it was almost like people had never heard that before when it all came out again. And so just being cautious, being careful, being healthy, like just take care of yourself, take care of the people around you, your family, your friends. So excellent advice there. One thing I would love to talk about is, and if you could speak to this, there is a greater, or there has been reported that there is a greater cause for those within the LGBTQ plus community to be concerned with monkeypox, specifically men who are in active relationships with other men. And so would you say that you've seen that to be true? And should they be taking different cautions and different precaution, I should say?
Yeah, so the CDC reports, what has come out was that the men who have sex with men, that community particularly has been, severely impacted with monkeypox, or disproportionately impacted with monkeypox. But I think the bigger point with that is, the focus should be, it's the high-risk sexual behaviors.
So let's not focus on the people group. Let's focus on the activity.
The activities.
Okay.
So the same high-risk sexual behaviors as men who have sex with men, LGBTQ, or any other gender groups have, heterosexual people are at the same risk with those same high-risk sexual behaviors.
And that's so important to note, too, because there is this stigma of like, well, I'm not really in that demographic, so I'll be fine.
And I think that's where, some of the caution should lie. When we stigmatize, this monkeypox, a certain group, it gives everybody else the false sense of security that, I can go on and this doesn't apply to me. I'm not a man who has sex with men, and also stigmatizes that particular group, which might make them feel less comfortable reporting their symptoms, or even less comfortable speaking out about the disease itself. So I think, every time I get that question or I read that, I always think, okay, the focus needs to be on the high-risk sexual behaviors. That's really what the risk for transmission is, not more so, someone's specific gender identity or sexual preference. That's not going to, get you monkeypox. Men who have sex with men, gay men, women, if they practice safe sex behaviors, safe infection prevention practices, the same practices, the same behaviors that, a straight or heterosexual person, they'll be protected as well.
And that's excellent direction to give, is focus on the choices you're making and the activities you're participating in, and take appropriate precautions. And because, even if you're watching the news, if you're wherever you're gleaning your information, hopefully, the Virginia Health Department website or the CDC. But I think it is important because we're hearing things like, they're sending all kinds of, vaccines and education information to a lot of the Pride events that are happening, which is great because they're going to help educate them and give them the resources they need, especially telehealth companies who are offering for the LGBTQ plus community. They're adding treatment and into their primary care plan. And so that, you don't have to worry about making a sick visit. You don't have to worry about the stigma of going in because you have this. It'll be part of the primary care. And so I've seen that out in the news. There's a lot of information floating out there. And so excellent direction. Take care of yourself based on the choices you're making and the environments that you're putting yourself in, not necessarily because of a demographic that you may or may not fall within. And that kind of brings me to my next question, which is the vaccine. So the vaccine there's a subset that have been early approved for the vaccine, and it is that same demographic. And so yes, because of the choices they're making, they may need that a little bit differently. But what can you tell us just about the vaccine in general? Like, what do we need to know about this monkeypox vaccine? Because vaccines can be a little bit of a
It's also a
shaky
controversial
subject.
topic, right?
Yes.
So, with COVID, vaccination, not just with COVID, with most, preventable diseases, vaccination is always the number one way to protect yourself. Right now with the monkeypox vaccine, it's limited, just to supply to, like you said, those high-risk groups or those individuals who are at risk for developing severe disease where they to get monkeypox. I assume, down the road, availability is going to increase as production increases as well with the vaccine. Currently, the vaccine that's out is very similar to what's used for smallpox as well. And smallpox has been an eradicated disease for quite some time now. So right now, still in the works, availability isn't as widely available. But like you said, those high-risk groups who need it is definitely, available, through talking with their healthcare provider, looking at their risks, and their likelihood for developing or progressing to severe illness with monkeypox.
Yeah. And I think it's also really important to remember that, yes, the vaccine availability may not be so widespread at the moment, but this isn't a virus that we're seeing widespread at the moment. And so there isn't cause for alarm or alert. Just be cautious, be careful, be smart. And so in our community specifically, and I know you're new to Lynchburg, but this is your home. And so I want to see if you could speak to a little bit about how our community can and should prepare. Like, what precautions should we be doing? And are we seeing any kind of impact currently in our community?
Yeah, so the Virginia Department of Health's website, right now, Northern Virginia is probably impacted the most right now, just in terms of raw cases of monkeypox. Central Virginia, Lynchburg, we're definitely, not at the bottom. We're right around the middle or so in terms of the overall case counts. Lynchburg, we've definitely had cases of monkeypox, definitely been impacted. It's definitely on the rise. Like you said, overall, just looking at terms of numbers and, how many people are in Lynchburg, it's still a very, very small proportion so far. But, in terms of protecting themselves, the community, the CDC, I think they did a great job outlining just 3 very simple measures to protect yourself, which I think applies universally to all of us. First, they recommend, avoiding direct skin-to-skin contact with anyone who has a rash that looks like it could be monkeypox. They also recommend avoiding sharing bedding, eating utensils or clothes or even towels with someone that might have had monkeypox or someone with monkeypox. So we know that secondary transmission, is a risk, and it's, we're seeing monkeypox that can be transmitted through that route. And they also recommend, hand hygiene, especially after using the bathroom, before touching your face, before eating. Again, that's going to prevent, any further transmission. It's going to help, protect yourself, before you're eating. We touch, thousands of surfaces, throughout our day-to-day. And you never know who before us might have touched those surfaces or what has those surfaces come into contact with. So hand hygiene is always at the forefront when it comes to just prevention. In addition, something especially for the university age students, we recommend, practicing those safe sex behaviors. We know close, personal, intimate contact, it's the primary way this current wave of monkeypox is spreading. So, things like practicing safe sex measures, like using condoms, limiting the number of sexual partners you're engaging with, having those conversations with your sexual partners, asking them how are they feeling. All of those are important steps I think all of us can take, especially, our college-age kids, and all of us here in the community, just to protect ourselves and protect others around us from monkeypox.
Is there anything that, to your knowledge, that is being done for those university environments? Because, this really past 2-week period has been that flying around the country headed back to your campus. And that's a lot of people coming together from different places. And so is there anything that is being done or being offered as far as education, as far as maybe even vaccines, just to have them available at those sites? Anything being done in that way?
Not to my direct knowledge, but I am sure there's education occurring.
Yeah.
I'm sure the same infection prevention practices are washing your hands.
Yeah.
Practicing safe sex behavior, living safe sex partners.
Yeah.
Those messages, that kind of education has been pretty standard.
It is. And it's good to know. So. Like, it's something that it's not like this is the first time anybody is hearing it. But this is a college town. There's so many colleges, universities in this area. And so we do, I feel like Lynchburg and the areas surrounding Lynchburg, we feel that when the students come back, and it's so good to have them back, but it's also, a lot comes with that. And so I want to be sure that they're hearing that they are safe and that they need to be careful and take care of themselves. VDH.virginia.gov, you can go and you can get information about monkeypox. And it's really will give you the gamut of what you need to know as far as, what the basics are. A lot of what we talked about today, preventative measures you can take, what to do if you do see that rash and you do start to have those symptoms, how to get in touch with your primary care, or just how to get in touch with a facility that can help you. I know that there are other health systems who have vaccine interest forms available, just to kind of put something out there, give you an avenue to figure out what to do next. And so I do encourage you guys to head to those websites if you do have any questions. And we'll, of course, provide a transcript for this so that you all can get those questions answered as well. And Lentz, thank you so much for being here. Is there anything else that you feel would be very important for us to know about this particular virus that we haven't already talked about?
I would say, when COVID first came out, we were very ill prepared, across the board. It just testing wasn't available, vaccinations, treatments. They weren't even really 100% sure how it was spreading. With monkeypox, I think it's a little bit different. Already we have commercial testing already available which can be done through a healthcare provider. Vaccines are available. The way it's spreading, vastly different from COVID. And I think this go around, we are much more prepared to respond. And at the same time, I think it's, although we're much more prepared to respond, I don't think it's something we should take lightly. I think we should still give it our full attention, still give it the full gamut of tools that we can throw at it to make sure it doesn't become anything close to what COVID was. And I think that can all be done by all of us just taking very simple infection prevention measures. At the basic, if you're ever questioning what to do, to wash your hands.
Yes. Please
and
wash your hands.
You'll be doing a lot.
So. Wonderful. Very important message. Thank you so much, Lentz, for being here. And thank you all for joining us today. We hope you'll join us next time on Centra Scripts.